As I said, I'm a nurse. I've just started working at Palmetto Richland Heart Hospital over the summer, and then I'm continuing with doctoral studies at USC right now. And I was aware of this problem vaguely. I got into nursing after another couple degrees because I started working with the HIV/AIDS population, and that's a population here in South Carolina that's primarily minority, primarily poor, and most of them lack any health insurance. And then the farther I'm going in my school and starting to work at the hospital, I'm just seeing this problem repeatedly. I mean, as Liz has stated and as Larry's spoken to their situation, a lot of what we have in the hospital, of course I work with people with cardiovascular disease, they come in when they're conditioned, whether it's heart failure, it's a heart attack, if it's respiratory, they're in a emergency situation. They come to us, we see them for a few days, we get them settled, we might do some diagnostic tests and do an intervention. As nurses, our job is patient teaching and helping patients manage their own health care. And that's made virtually impossible when we're working with so many people that you know when they go out the door, they don't have any insurance, they don't have the expendable income to buy those prescriptions, to actually meet these follow-up appointments. And so it really just creates a cycle. And I would say it's at least half my patients that I see this problem with. I've started asking people when I'm starting to talk to them about their discharge instructions, I just ask them, do you have insurance? Do you have a way to pay for this? Because if not, we need to address that problem before I start trying to explain to them why they need to be on Plavix the rest of their life. Because they don't care. If they don't have the money, you never get to that point. And so that's where I've come from and how I've come to feel very strongly about this issue. So I'm involved with South Carolinians for Universal Health Care. We're pushing to get statewide. We haven't gotten to the upstate yet. We've had some meetings here in Columbia. And
that's Paul DeMarco.
Yes, Dr. DeMarco and Lynn Bailey. She told me that she'd been in some contact with you. Basically, at this stage, we're in the advocating and the educational phase. We are trying very hard to pull together board members with people from the hospital industry, trying to get a varied group together, because we're trying to get past that. We're all Democrats and we all feel this way and we're preaching to the choir with each other. So we're trying to expand and those sort of things and get a different group of people together. And basically at this point, meeting, doing things like working with the Healthcare Now group and trying to provide a central place for a voice and for information dispersing and that kind of thing. So I've gotten involved with this because of school, but I think I'm going to stay with it. I feel very personally passionate about this.